Welcome back. What do you need to know about your baby's visual development and when they need to have their eyes checked? This is so interesting and important. Our 9 Health expert, Dr. Payal Kohli, is joining us this morning with some things to watch out for. Thanks for coming in.
My pleasure.
So I just asked you, don't they test for this right after they're born?
In fact, no. For most babies, they don't test when they're born. They only test the babies that are premature, so less than 34 weeks, or if they have a history of cataracts or eye tumors. So the first time your child's vision is going to be tested is usually around the 6-month well-child visit.
Wow. Okay, so when do babies really develop full vision?
Yeah, when they're born, their vision is like 2200 or 2400. So basically all they can really see is kind of bright lights, moving objects. They're not really getting 3D vision, the ability to sense depth perception until about 5 months. Similarly for color vision. And if you notice, Corey, when you look at your baby, they're more likely to open their eyes in low light because they're extremely sensitive to bright lights when they're born.
This is so interesting. Another thing is if babies are a little bit cross-eyed for a while, is that something to be concerned about? Because it seems common.
It is common and it's normal, in fact, because it's the muscles of the eyes that control the eye movements, at least for the first 2 months, that really take a little time to train. So it's okay for the baby's eye to wander a little bit, the baby to look a little cross-eyed. The time you want to start being concerned is if they're consistently turning their eye or one eye in one direction all the time. Then you could be worried about something going on inside, inside their muscle, inside the brain, that could be causing them to do that.
So when should you first have your baby's vision actually checked to make sure that they aren't looking at things really close or having headaches from it or whatever?
So 6 months is when your pediatrician will likely test their vision. Okay. But if you have any signs or suggestions that the baby is not tracking you, or the baby's not opening their eyes, you're seeing any concerning findings like red eye, like a squinting of the eye, excessive tearing of the eye, even a change in color of the iris, which is the colored part of the eye, those are all concerning signs. You need to get it tested sooner.
Is there anything that we should be watching out for where you're like, I just need to go to the doctor right away?
There is, and this is something I want all parents to be aware of. So when you take your baby's photo, look at their eyes. So the pupil is the black part of the eye, and sometimes when you take a photo it looks red because there's blood vessels back there. But if it looks white, like a cat's eye, that
like
is
this?
Yes, exactly. That is a potentially concerning sign for an eye cancer called retinoblastoma. And essentially the retina is sort of the screen in the back of the eye. The cells are dividing so quickly because the baby's eye is developing quickly, so they can become cancerous in little kids. But if caught early, you can cure your child. If caught late, of course, you compromise the vision. You could lose the entire eye. It could even be more serious than that. So you really want to look at your child's eye in every photo to make sure it's either red, the black part of the eye, or it's black. But if it looks white, it's time to get it checked out right away.
At what age?
It could occur at any age. In the first few years of life is the most common, but really from the time they're born to the time they're toddlers. And actually we had a scare in my family. This is what made me want to talk about this, because my nephew, at a certain angle, his eye looked a little bit whitish to me. And we just happened to catch it at a certain angle, but we got his eyes tested, and guess what? He needed glasses.
I know every mom and dad's at home right now like looking through all their pictures, which is good. That's why we love having you on. Dr. Kohli, thank you so much.